Welcome to these additional episodes of Your Pregnancy Week by Week. We're going to provide information about things you may want to know about before baby's birth and in the weeks and months after baby arrives. Dr. Glade Curtis and I hope these discussions will help you and your partner settle into your new roles as parents. The information in these episodes is a general informative guide. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctors. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your life with baby and after pregnancy concerns, questions, or interests into words. Each episode will cover one topic. Our discussions are intended to help guide you through the many new experiences awaiting you. So let's get started on this discussion. We're going to talk about flying during pregnancy. Pregnant women often ask if it's okay to travel by plane. If your pregnancy is uncomplicated, air travel is usually okay. Ask your doctor about it if you're considering flying before you make firm plans or buy tickets. The American College of Obstetricians and Gynecologists says the safest time for air travel is in the second trimester, from 14 to 28 weeks. In the third trimester, many doctors advise staying within a 300-mile radius of home. The decision on whether you can fly and how far should be a joint decision between you and your doctor. Travel by plane is not recommended for pregnant women with certain complications, such as preeclampsia, premature rupture of membranes, or women who are at risk of preterm labor. Carrying more than one baby? Your doctor may ask you to stop traveling earlier because of a higher risk of complications. The biggest risk of traveling during pregnancy is developing a problem while you're away. Signs you shouldn't travel include severe swelling of the face, arms, legs, hands, or feet, bleeding, severe nausea and vomiting, cramping, extreme and or continuing headaches, or fever. If you do decide to take a trip by plane, be sensible in your planning. Don't overdo it. Take it easy. Most airlines let women fly up to 36 weeks of pregnancy. The cutoff is often 32 weeks if you have a multiple pregnancy. For international travel, the cutoff is usually 35 weeks. Pregnant women at high risk should avoid all air travel. Additionally, high-altitude flights may need to be avoided because oxygen levels can be lower. This increases your heart rate and baby's. Baby also receives less oxygen. When you fly, wear loose-fitting clothes and shoes. Wear support stockings to reduce swelling in your legs and feet and to reduce clot risk. Drink lots of water to keep you hydrated. Take along an empty bottle and fill it after you go through security. Keep refilling it. If your flight serves a meal, order a special meal. If your flight doesn't serve food, bring along nutritious snacks. The risk of deep vein thrombosis increases with the length of a flight. Get up and move around when you can. Sometimes just standing up helps your circulation. Try to get an aisle seat close to the bathroom. It's easier if you don't have to crawl over someone to get out. Screening equipment at the airport security checkpoint is safe for pregnant women. They don't use X-rays. You can always request a pat-down if that eases your mind. Before booking a flight, check out travel insurance. If travel restrictions change, your doctor recommends you stay home, or if you experience serious symptoms, you may need to postpone or cancel your trip. Travel insurance can help you recoup costs of canceled plans. It's always a good idea to check out hospitals located near your destination. Be sure you have your doctor's name, address, and phone number with you too. If you're taking any medications, make a list of them and keep it with your doctor's info. Flying during pregnancy can be fun, but be smart about it. Take care of yourself and baby. If you would like further information, check out our book, Your Pregnancy Week by Week. You may also want to check out our book for partners, Your Pregnancy for the Father-to-Be. If you want to find out more about our podcast, visit our website, yourpregnancyweekbyweek.com. Looking for something specific? Check out the podcast topics list. It lists topics covered in each weekly pregnancy episode and our Let's Explore More segments. Follow us on social media for updates, new podcast episodes, and important information. Visit Your Pregnancy Week by Week, all one word, on Facebook and Instagram.